The holidays are supposed to be joyful, full of lights, laughter, and a time with people we love. But every year, right around this season, a predictable set of health problems show up. Some researchers even have a name for them, Chrishaps. That term isn't inclusive of all holiday traditions, but it is kind of funny. So we had to give it a shout out. Maybe Hannukahtastrophes? Let's go middle of the road with Holidisasters. I guess it doesn't quite have the same ring to it. In any case, we're talking about the unexpected mishaps and illnesses that tend to cluster around the holidays, and that's the topic of this week's Healthcare Triage. One of the biggest reasons holiday illnesses happen has to do with how we celebrate the holidays. We gather indoors more often, we travel, we attend crowded events, and we spend long stretches of time in close contact with others. Maybe we accidentally dunk our fingers in the cheese dip. That makes it easier for contagious illnesses like common respiratory infections to spread. A simple way to reduce that risk is paying attention to basic hygiene, washing hands regularly, and staying home when you're feeling unwell, even if it means missing a gathering. But gatherings aren't the only culprit. Food's another hallmark of the holiday season that could lead to us feeling less than stellar. Large meals, rich foods, and irregular eating schedules can cause digestive issues, and for some people, worsen existing conditions. Eating a bit more slowly, staying hydrated, and listening to hunger cues can help your body keep up with the celebration. Washing your hands and pacing yourself at the table might seem like obvious health habits during the holidays and beyond, but there are a few holiday-related health problems that we tend to think about less often. This includes injuries related to decorating, lifting boxes, climbing ladders, and navigating icy sidewalks. There are also increased medical issues related to seasonal decorations, live trees, candles, and indoor air changes that can trigger allergic reactions or breathing discomfort. The holidays can also be physically and emotionally demanding. Disrupted routines, lack of sleep, travel stress, and pressures related to things like family and finances can take a toll on the body. Stress definitely affects our mood, but it can also influence heart health, energy levels, and overall well-being. A 2018 study looking at over 280,000 cases over a period of 15 years found that the risk of heart attack was higher around the holidays, particularly in individuals over the age of 75 with existing health conditions. In a 2021 study, researchers found increased incidence of stroke in medical records for the periods preceding Christmas in Hungary compared to the period following the holiday. Another 2021 study reports significant changes in the pattern and frequency of cardiovascular-related mortality around winter holidays in central Norway. This was contrasted with a much more stable pattern of cancer-related mortality around the same time, suggesting that the increased holiday risk is specifically related to the cardiovascular system. But let's not let any of this dampen the holiday spirit. We can take some preventive measures to keep things on the enjoyable side. First of all, keep those vaccinations current. Have you had your flu vaccine this year? Second, as you celebrate, slow down when you can. Make a point of getting rest, tuning into hunger cues, and staying hydrated, and being mindful about your social interactions and the holiday expectations you might be trying to live up to. Take care of your body and your mental health, and try to enjoy the holiday. Hey, did you enjoy this video? You might enjoy this previous video on classic holiday myths. We'd really appreciate it if you'd like this video, subscribe to the channel down below, consider going to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Joshua Crow, Edward Lilyaholm, and Christopher Learn, and of course, our Surgeon Admiral, Sam.